lower half of the forehead is the area where injectors make the most mistakes. It's closely related to position of the brow. So injection in the space can affect the drop of the brow or can be the cause of a little Wi-Fi that can form after the injection. Let's break it down in two simple terms. One, for who you can inject in this area and not worried about any sort of issues, are the patients who look like this. So those are the patients who have very deep set eyes. You can see some distance between the orbital bone and the eyeball itself, almost like missing the volume behind the eyeball. For these patients, you can inject this area with your normal dose at your completely even distribution between the upper and the lower portion, and they will never have an issue with the eyelids or eyebrows. On another hand, you have patients who look like me, who have shallow set eyeballs, and there is no space between the orbital bone and the eyelid. It kind of all blends together. In their situation, the skin is very closely related to the brow position, and any relaxation of this frontalis portion next to the brow will result on this extra skin of the eyelid hooting over. If the anatomy of the orbit is like mine, you need to see if they have a compensation. If they rely on compensation, which I described in this video, the test that you need to do, in this case, do not inject any frontalis. I don't care, upper, lower portion, just don't touch the frontalis. But if they're like me, they have the shallow eyes, but they don't have compensation, I can look at you without needing to lift my brows. In this case, inject light dose. Concentrate most of your dose here, lightly here, and reduce the total dose to half of what you would normally do. If you found this video helpful, check out the link in the bio for upcoming seminars. The botulinum toxin seminar is going to be August 1st. The next one, we're going to cover the entire face, neck area around the masdio, the chin area, the lip flip, platysmal bands. We're going to cover body areas and break down the units and complications. So everything that you need to know. Registration is already open, and until the 5th of July, there is a 10% discount on all the courses, even the pre-recorded, even your one-on-one mentorship, even your one-on-one hands-on training at 10% off until July 5th with a promo code FREEDOM250.